Now, I have the honor of introducing City of Columbus Health Commissioner Dr. Mysheika Roberts. Dr. Roberts leads a team of nearly 500 public health professionals who are focused on neighborhood-based approaches to address the social determinants of health to decrease the health disparities that exist in our community, including our community's most critical health issues such as infant mortality, the opioid epidemic, tobacco use, and obesity. Thank you for joining us, Dr. Roberts.
Good evening, and thank you all for being here. I am so pleased to join my friend and CEO, Erica Clark-Jones, Board Chair, Peggy Anderson, and all of you for ADAMH's annual meeting. Thank you so much for having me. 2020 has been a challenging year as we face a once-in-a-lifetime global pandemic. Ongoing civil unrest caused by the senseless killings of African Americans, and a divisive election for our nation's highest office. As 2020 begins to wind down, we all have been adjusting to our new normal. Celebrating important family milestones like birthdays, holidays, graduations, and weddings virtually. Working remotely and educating our children at home. Watching sports and our favorite teams like the Buckeyes at home from the comfort of our own couches instead of in the shoe with 100,000 other fans. Holding meetings and important milestone events just like this one virtually. And helping those with the brain disease of addiction as they deal with not only their condition, but the added stress of isolation from friends and family, job losses, getting the critical support they need in a new and different way. Indeed, these are challenging times for all of us as we adjust to the new normal of our lives in 2020. This year, we've all faced challenges most of us could not have even imagined possible or even plausible in our lifetimes. But these challenges are magnified for those suffering with addiction. COVID-19 and the isolation and social distancing that comes with it increases the potential for risk-taking with drug and alcohol use. As you know, boredom and loneliness can trigger addiction, and the added stress from the pandemic and resulting life changes can contribute to a relapse in addiction. Many individuals are using for the first time to try and cope with stress and the uncertainty. Others are using again after not using for months or even years. And because of the social isolation, people are using alone, where there is no one to administer Narcan nor call 911 to save them during their overdose. As a result, our community has seen a dramatic increase in overdoses during this pandemic. In the first quarter alone of 2020, there was a 50% increase in overdose deaths. Just let that sit in for a second. And it was a deadly summer, as nearly every weekend we saw a surge in drug overdoses. In one weekend alone, just a few short weeks ago, we had 32 non-fatal overdoses and 7 overdose deaths in a little over a 24-hour period. We are in the middle of an overdose crisis right here in our community. In response to this immediate crisis, Columbus Public Health has implemented several new initiatives this summer. First, Columbus Public Health started a mail-in Narcan program to help reach those who are isolated at home and reluctant to come to naloxone distribution events. And we increased the number of Narcan kits distributed to individuals who responded to our risk assessment as being highly susceptible to an overdose. In addition, we also increased our pop-up Narcan sites with community partners such as the Ohio State University Wexner Medical Center, the Columbus Division of Fire REACT Team, and Southeast Incorporated. Additionally, we conducted walk-in for recovery events all summer long in neighborhood locations to provide Narcan, fentanyl test strips, hepatitis A vaccinations, HIV/EIS testing, and referrals to medical detox and treatment. By meeting people where they were, we were able to engage and assist almost 30 individuals per week. Many of them were people we never would have been able to reach otherwise. While these are important and timely ways to prevent overdoses, our work is far from over. This crisis cannot be solved by one person or one organization alone. It takes all of us working together to address it. It takes a strong collective commitment, a commitment to saving as many lives as we can today by working to prevent addiction in the first place tomorrow. But we do not do this critical work alone. You, each of you, are important partners. Columbus Public Health is pleased to join all of you as we work to address the addiction crisis right here in our community. Remember, addiction is a chronic relapsing brain disease that people neither choose nor want. And in order to help those who are already addicted and to prevent people from becoming addicted in the first place, we must start from the understanding of the brain disease and its tragic impact on individuals, families, and our entire community. It is the only way we can begin to break the stigma that prevents people from getting the help they so desperately want and need. The addiction epidemic is a public health issue, and we must address it with the same understanding and commitment as we have with other epidemics, such as HIV. We are so fortunate to live in a community where so many people and organizations get it and are committed to this work. ADAMH is one of those and a lifeline in our community. ADAMH is critical to helping our residents find affordable, quality addiction and mental health services. We simply could not help those who need it most without ADAMH and its system of partner agencies who are on the front lines every day doing this critical work. Our residents with substance use disorders count on you. Their loved ones count on you. Columbus Public Health counts on you. And our community counts on all of us. Together, in the coming months, we must build upon our existing infrastructure and leverage community resources to maximize our collective impact on this overdose and addiction epidemic. As we continue to battle COVID-19 and its impact on those suffering from addiction, our work and our response is more important than ever before. While we continue to adjust and find new ways to reach and engage those with addiction, we must continue the tools at our disposal, including public health surveillance on drug overdoses, EMS runs, and deaths. This information will help guide our community in understanding and responding to this devastating disease. Columbus Public Health is proud to lead the Columbus and Franklin County Addiction Plan to guide our community's efforts together with all of you. We are working to stabilize the crisis in the short term while offering important long-term prevention strategies. This community action plan is our roadmap, and it will help guide us during the COVID-19 pandemic and the new normal that awaits for all of us on the other side. What we learn and achieve together will help us address the changing needs during the pandemic and offer the best solutions for addressing the addiction crisis in our community. We must remember that change won't happen overnight, because it never does. But we are committed to this work and to doing whatever we can to make a difference to the moms and dads, sons and daughters, friends and colleagues who find themselves in the grip of addiction. We don't know what the future holds and how COVID-19 will impact us or our community. We don't know how long it will take to get a vaccine. We can't count on ever going back to life as we knew it before COVID-19. But while there are many uncertainties, we know we can count on ADAMH, as well as our community's commitment to helping those with the brain disease of addiction. They and our entire community are counting on you. They are counting on all of us, and we cannot and we will not let them down. Thank you for all you do to protect the health and improve the lives of everyone in our community. And thank you for having me here today.